Good afternoon. Welcome to our live today, and my name is Dr. Mercy, and I'm joined today by our pharmacist.
Dr. Kennedy Obonyo.
So today being World Health Day, we are here to discuss a few things. Of course, we are going to be concentrating mostly on preventive health because you don't actually need to be sick to get to see a doctor. And we're also going to talk about screening. Why do you need to be screened? Who needs to be screened? What are some of the few things that we need to check on every year, even if you're not sick? And then Dr. Ken will tell us about pharmacy and medication and how you need to handle your medication. So welcome once again, and on all our platforms here at HealthX, we also do drug deliveries and also doctor consultations. So we're getting right into it. So Doc, tell us something a little bit about medication management before we go on to the screening bit. Or what do you want us to know about pharmacy and medication management here at HealthX?
So, first of all, I want to welcome you to this live broadcast. This is HealthX. Just as a reminder, before I focus on what the meds can do, we do online consultations. We deliver drugs. If you have a prescription, you can share with us on WhatsApp, email, and other channels that will be provided to you. So I want to talk about meds in the sense that most of us are busy all the time, and we prefer going to a pharmacy nearby and maybe requesting for something, a quick fix. Say you have a running stomach, you just want something to fix. But this is to just let you know that most of the times, the things that present these symptoms sometimes are complex. So you may actually go to a pharmacy and request to have something to stop your loose bowel movement, not knowing that it could be food poisoning, could be also some infection that you don't know about. And it is a danger if you take that medication and block everything inside. The infection could become a super infection and hurt you more than help you. So most of the times when you go to a pharmacy and you need something as a quick fix, first of all, try to inquire if there could be any other causes to the symptom that you're suffering from. If it's a simple thing, you can fix it over the counter. If you think there could be other causes, it's always good to ask someone to refer you to a medical practitioner for them to actually investigate and do lots and lots of things for you to be safe so that you get the right care that you need. So I'm not discouraging people from going to pharmacies and buying drugs, but there has to be rationale. Let us be sure that the drug that we are buying is for the specific symptom that was caused by a given disease that we envisage to treat.
All right, that's actually pretty interesting. And talking about over-the-counter medication, so maybe we can have a comment on antibiotic overuse and not having the right information or not talking to the doctor. I know it's something doctors and pharmacists in general are really worried about the near future. So something about that.
Yeah, earlier this year we had there was a campaign. It usually happens every year. It's antimicrobial stewardship. So what is happening is, if you look at history, at some point, penicillins, the most common antibiotics, were coming from just they were just being byproducts of a given plant or an animal before, and they were working on everything. But right now, what we do right now is everyone wants an antibiotic for a given reason. Like, for example, I could be having a cold. A cold is essentially a viral infection. Most of them are self-limiting. You may not need any antibiotic. You just need the antihistamines to maybe stop your running nose, some paracetamol for your headache and stuff like that. But now someone will insist on them being given an antibiotic. And the danger with that is an antibiotic should only be given when you have an indication for it. Like, you have an infection, it's confirmed, you have fever, they've done tests, you have an infection. If you don't have a bacterial infection and you take an antibiotic, the antibiotic will get into your body, it will work the way it should work, but there's no pathogen to kill. So you get used to this antibiotic, and what you find out is you'll have resistance. Some people used to actually when you have an infection, you take amoxicillin, it works for you. Nowadays, such people, they'll tell you, no, amoxicillin doesn't work for me. I would want something serious. They usually call it something serious. Yeah. They say, I want augmentin, I want what. So we have levels in antibiotics. We have those ones that can be accessed by simple infections. We have those ones that are under watch, and other ones are under reserve. The ones that you cannot use until it is very serious. So if we use antibiotics indiscriminately, because I have a cold, I go to a pharmacy, they want to make a sale, they give me all those things plus an antibiotic, I'll feel that this person cares about me. But if we don't have a rationale for that prescription, for that medication, eventually what is going to happen is you get to a place where you cannot respond to medication. A very simple infection can actually kill you, because now you can't be treated. You are used to these drugs. The pathogens are used to these drugs that have mutated. Now you have a resistance.
Yeah, in other words, we are building superbugs that in the near future, we won't be able to treat. Just because we took the medication when we didn't need it. So that's something we really need to take into account. These superbugs are not something that came out of their own. No, we are the reason why we're having superbugs. So you get a certain infection. A few years ago, we could treat tonsillitis with amoxicillin. Right now, we give somebody amoxicillin, it won't even work. So you get sometimes people are going around saying, you know what, now Septrin is working. Because for a while, we haven't used Septrin. We've been avoiding it for so long that now if you do a culture, it actually works. It's something about just survival. So thank you so much for that insight, Dr. Ken. So what Dr. Ken is trying to say is at HealthX, you'll have access to the doctors. We can do a virtual consultation from the comfort of your home, your office, or even if you're in transit, as long as it's a private situation where you can talk to the doctor freely. And sometimes you probably have a prescription and you just download the HealthX app and upload your prescription, and doesn't mean you have to talk to the doctor all the time. Maybe you've seen your doctor and your doctor doesn't have a pharmacy and you need drugs delivered to you. So I know it's World Health Day and most of us aren't really sick, but how do you find out you're actually sick? Because screening is important. So what do you really screen for? Think of somebody will tell you hypertension, elevated blood pressures are not asymptomatic. Basically means it's a silent killer. It means you wouldn't know if you have hypertension unless you get your BPs get measured. So one is your blood pressure. You should take it, especially if you have a family history of hypertension and diabetes. Always make a point of doing your sugars. Always make a point of doing your blood pressure. And of course, these are the simplest tests. Also your BMI. Obesity actually is one of the leading non-communicable diseases. It means it's a lifestyle disorder. So I think maybe you can tell us something about diabetes and meds in that way.
Most of the times, I think there is a misconception out there. People don't get it correctly when we talk about diabetes and related conditions. But if you look at them keenly, these are lifestyle and metabolic conditions. So for example, take a case in point where you are a busy person, always in office. You order food, you order some, I will not mention brands, but you order some chicken, chips and soda.
Fast food or overly processed food.
Yeah. Every lunchtime you order those. And you have a liking for soda other than water, right?
Yes.
So with time, you feel okay. Your body, and there's something I like about the human body. It can survive for so long. It will correct, it will compensate for all the things you're doing to it until it can no longer do that. And you see, the bad thing about it is you will compensate for what you're doing. You're not taking enough water. Your kidneys are suffering out in there, but you don't know because they're just...
Your body is overcompensating.
So you do that for, maybe you get into work at around 24 years old, then you work for the next 16 years, you get to 40, is when now you start seeing some symptoms. This does not mean that this thing developed today. It is a 16-year of doing junk food, of a processed food.
And doing excessive alcohol intake.
And those things. So eventually, the reason why what Dr. Masi is talking about, it makes a lot of sense in preventive health, is even as you are, as fit as you are, check your GFR, the kidney function test, check all those things, you would realize that you began soda or these fast foods just 3 years ago. They've already done some damage, but you will not see that because your body is still compensating for it. It will only show you symptoms when you are gone too far.
Exactly.
So specifically for diabetes, if you look historically, long time ago, people used to hunt and gather and do all those things. It used to take
Physical activity.
It used to take someone so long to come about food. So right now, you can work, earn money, stay in your seat, do Glovo, do all those things, and they come to you. So what it means is we are not giving our bodies enough time to process these things. Long ago, it was natural to fast. You will eat one meal today, you have to look for other food. So you will work for so long, you'll do so much. So the body is made in such a way that you eat a meal, you digest it, you absorb it, then excess is stored. Then over time, when you store excess, you become obese, and these fats and everything, they cause you insulin resistance. And you see, something like diabetes is just, it's just insulin resistance. Your insulin is not,
It's no longer helping you.
Yeah, the insulin is not helping you get sugar into cells. So this sugar accumulates in blood, and then when you test for sugar, the sugars are high. And there are so many bad things about sugar accumulating in your blood. And that's what people call diabetes. So much as you will be enrolled to take medication and everything, they usually tell you lifestyle changes and exercise. And those are the most important. Because if you take drugs, they'll help you with your insulin and everything. But you also need to help your body work as it should. So there is a lot to be done, and these things you could be explained to by our doctors that are available online. If you book in for a consultation, you can ask any questions. They can actually direct you to the right way of doing this. If you have issues with your body mass index, we have nutritionists, we have general practitioners. They'll take you the right direction so that you can even teach yourself how to. I don't talk about. I don't want to focus on calories, but they could actually help you focus on when to eat what after how long.
Yeah. So something that I was reading about recently is most of these cancers, apart from cervical cancer, where we've seen it caused by HPV subtypes, most of these cancers just have risk factors, and all their risk factors actually. If you start from esophageal cancer, you go to gastric cancers, you go to even colorectal cancers. The lifestyle risk, people, all the risk factors are actually similar. People who smoke, people who take alcohol, people who physical inactivity in your diet, especially, like the commonest causes of cancer mortality around it is around esophageal, cervical, breast, and colorectal. Because by the time you get symptoms, for example, for colorectal, you're far gone. You'll have very non-specific symptoms. But these are things you can screen for every year. You can put it as part of your wellness package. You do stool for calf blood every year. So you catch it before then. But you see also with colorectal cancer, it's persistent, continuous. If you constipate continuously, you're changing your large intestine, your colon as you go. If you're constantly constipating, you're injuring your rectum. Every single day you're bleeding while going for that long call, you're putting your risk for developing cancer higher. So how do you do that? High fiber food. If you take high fiber food, if you hydrate, physical activity, all these in the long run actually help you with all that. So I know we usually talk about wellness packages and all. So how do you know a wellness package is actually working for you? So if you're a lady, you want to think about doing a pap smear every 3 years. And talking about pap smears, I know cervical cancer month was in January, but also we need to think about things to do with HPV testing. It's now the gold standard. You do it once every 5 years, but maybe our insurances are not gotten to the point of testing for HPV yet. So we do pap smears every 1 to 3 years. And any lady who is, I remember this year during the COGS conference, one of the things they really talked about was COGS is like Kenya, whatever, for gynecologist organization. So one of the things they really insisted about is every lady under 45 needs to be vaccinated for HPV.
HPV, yeah.
I know there's the one run by the government for children, girls under 10, but as long as you're less than 45 years old, you're still viable for vaccination.
Vaccination.
And also, apart from that, how are you eating? What's in your plate? Is your plate just full of carbs and processed food? Because a few years back or a few generations back, our parents, our grandparents, they survived and ate differently. Food didn't come with spices, and spices are just a lot of processed chemicals.
Sure.
Food, they will just go take some potatoes, take some, they boil it. They are not in the generation of frying things. Like they steam, they boil, and we always talk about how do you cook? What's in your plate? I mean, is it veggies? Is it a whole lot of ugali and less of veggies? At home, they do is it grade 2? Leave alone the grade 1, the one we're always buying. That grade 2 is actually healthier and has more fiber than
the one that is sifted.
Because if you're constantly seated in the office, when are you going to put in your steps? And you're eating junk food from morning to evening. We're walking around with our coffee mugs. We're not even hydrating as we should.
Sure.
So how do you know your like I said, how do you know your wellness package makes sense? One, you need to talk about your blood pressures, especially for people with a family history of hypertension. 2, your blood sugars. That wellness package has to have blood sugars. So mostly it's a fasting blood sugar. Other people even offer HbA1c, which is the gold standard for diagnosing diabetes.
Sure.
You want to talk about your stool. The stool for calf blood, we are looking for any bleeding within the gut, and also we are screening for colorectal cancer. There has to be a pap smear for cervical cancer. There has to be an indication for liver injury. We mostly do DGT or liver function test, and we also have to do kidney function, and you have to do your EGFR, because if you're not hydrating, in the end, you'll bring yourself more issues than you need. So I know people on chronic medications, that people already hypertensive, diabetic. What is something you can tell them about pill management?
So most of the times when you have a chronic condition, say you have diabetes, and the reason
or even you're a caretaker of somebody who has that.
And say most of the times when I like picking on diabetes, because diabetes is being a metabolic disease, it will actually affect every organ system.
Yeah, actually, it begins, a little bit to interrupt a little bit. I know somebody was saying there's this meme that goes around. Diabetes is actually we are scared of HIV, yet diabetes is the monster we think HIV is. So you can just go ahead.
Yeah. So diabetes is an interesting condition. It's actually, it puts sugar in every organ, and most of these organs are not meant to deal with those excessive amounts of sugars. So if you're a caretaker, for example, these meds that most meds that we give people who are diabetics will help with lowering the sugars, but they'll have other effects, and most of these effects will in turn be controlled by more medications like supplements and other things. So the reason why I was insisting on being physically fit and maybe trying to do lifestyle changes is because if you do lifestyle changes together with the medication that you start with, you are likely to take less of the medicine and do more of the exercise than be good. If you don't, what will happen is it will be an upward spiral. Like you began with, say, metformin alone. Now you need clybenglamide and metformin. Now, from a short while now, because of the risks of cardiovascular issues, now you have to take something like empagliflozin. Then from there, now because of metformin, your B vitamin levels are low. Now you have to take the Neurofort and stuff like that. So you see, most of the times, we wouldn't want you to be burdened by pills. Yeah. So what we do is, if you consult with our doctors, what we'll do first of all is to find a medication that actually is going to cover everything that you're suffering from in terms of symptoms, but at the same time be a combined fixed dose combination, right? So for example, if you're taking say metformin and another drug and another one and they are separate, then we find that in the market there are so many combinations. So we will find something that has those two, so that the number of pills taken in a day is reduced. Because I don't like
the pill burden.
Yeah, I don't think there's any person who wants to take so much. It's not food. Another thing we do is we have a CDM program, a chronic disease management program. So if you enroll with us with the doctors, so what we will do is we will follow up with you, see how you're doing, make sure that the drugs that you're taking are actually
right
helping
ones.
you and you are taking them correctly. Because if a medication is meant to maybe lower your pressure by increasing your peeing, then you take it at night, you will not sleep. You'll actually curse the person who wrote the medication for you. So what we do is we find that we follow up. We want to know, how are you taking this drug? You tell us, I take it at night and I barely sleep. Then we are like, oh, you shouldn't take it
At night.
at
You should
night.
take it in the
Take
morning.
it in the morning because you walk about, you will not realize that it is a bother. But if you do it in the evening, it is going to be too much. So we have a CDMP program. We will make sure that we check on you, make sure that you are taking those medications very well. Then there's something called medication therapy management, MTM. MTM is it's kind of a drug utilization review, DUR. So what we will do is just follow up to make sure that you are getting the best out of the medication that is prescribed for you. And if you are not, then we need to do these reviews, the tests. So like, for example, someone on anti-diabetics, at least 3-4 months, they should do the HbA1c, the gold standard, so that we see, is it consistently around 7 or beyond that, so that we see, are our meds really
Actually
helping
helping
the patient?
you, or are they making you worse?
Because if they don't, you get to a point where you need to take more for an effect that you would have taken just a simple medication with the right instructions, with the right, you see, we get in touch with you plus your caretaker, so that it's like a checking system. If your caretaker knows this information and you also know this information, then there's no room for error.
Yeah.
So at HealthX, we are here for you. Feel free to reach out. You can reach out to do a consult, and then from there you can sample other services.
All right. So I know you've mentioned something about caretakers. I know most of us are the ones who get to parent our parents of sorts,
sure.
because now you're the one who needs to make sure the meds are there. So usually when we usually advise our patients, you call us in when the meds are like 5 days, because you can call today, the meds are, I'm done with the meds today. Then we're like, okay, so do you have anything for today? See, you need to call us beforehand, and then we also need to call you before that. So I know, as much as pill management and pill burden is a big issue, I like what you mentioned, that there is something that got us here. And this generation, most of us are going to get lifestyle disorders before we hit 40. Because if you don't exercise, if your diet has no fiber, if you're eating a lot of processed sugars, if you're not eating fruits, you're not eating vegetables, we just want to get our essential vitamins from tablets and supplements. There's no issue about supplements. Actually, some micronutrients are not found in food, so we supplement.
Yes.
But before you actually go into supplementing, you need to make sure you can't find it in food. Because if you're having vitamin C issues, and let's say you're not having the excessive type of vitamin C where you even have scurvy and bleeding gums, but you're just having not even low, you take
Just
some
near normal.
near normal, you take some oranges, your body will easily absorb that orange compared to vitamin C tablets.
Yes.
Because your vitamin C tablets, if it gets to your body and your vitamin C levels are normal, you're just going to be overworking your kidneys for no reason.
Because it will get out.
Exactly. So that's very different from when you're not able to sleep.
Sure.
When you're not able to sleep, you'll see the doctor will prescribe magnesium with melatonin,
Sure.
because magnesium has been shown to help with your sleep cycle. That's a different story. But if your magnesium levels are normal and your inability to sleep is something to your mental health,
Yes.
you're going to be having like magnesium toxicity. So
Sure, yeah.
that visit to the doctor is very important, because we'll get to see, are you anxious? That's why you can't sleep. Or are you depressed? Or is there something else going on in your life? Are there any changes?
Sure.
And I know we also talk about wellness, and we've talked about nutrition, your physical activity. We have to talk about sleep. So Dr. Ken, how many hours of sleep do you have in a night? Or rather, last night or in the last 1 week?
I could be a victim, because I usually do 6, 7, on a good day 7, but mostly it's 5, 6, which is not ideal, by the way.
Yeah.
We need to do 8
hours.
8 hours. 8 hours of sleep is okay, because you have a 24-hour day. So if you do 8, then you subdivide the 16 in your activities. Yeah, I wanted to mention something. You mentioned something about exercise. And people get it wrong. They think that exercise is for people who are plus-sized or obese or something. You could be very lean
and still have high cholesterol levels.
And still have very high cholesterol levels. You are at risk of diabetes and everything like that. In some situations, BMI will not really tell you the clear picture of what you are.
A body composition would help. Yeah. BMI is not the best.
So you would want to compare these tests and whatever parameters you're using to gauge yourself whether you are healthy or not. The people who do short distance runs and long distance runs, someone just stops after the race and collapses.
Yeah.
And it's a heart attack. And you're like, this guy was the most physically fit person I've ever seen. And you're like, what? And those things are about, do you really know how good your body is? Because symptoms often show when something's already gone wrong. So you need to catch this before it even happens. If I have a heartburn,
yeah, exactly.
If I get a heartburn, some heartburns will present with referred pain in the back. So you will be like, is it a heart attack or something? No, so we need to understand, if I'm suffering from this kind of pain, am I just going to run for an antacid, or I want to know exactly, did I eat something that aggravated this thing, or it's something else, it's food, it's not related to food. Some people with allergies will present with what we call Clover sensation. The esophagus is trying to close.
Yeah.
So you feel like you are choking, right?
Yet you're just allergic to peanuts.
Yeah, but that has nothing to do with you having reflux. So you go take reflux medications because you
think you
just went to a shop and bought without consulting doctors. Then you take that for a long time. The funny thing is, sometimes you take the wrong medication and it tends to work.
Like a placebo effect.
Yes, because you already planned that it will work. But with time, what you are doing is just burdening your system and hurting yourself.
Yeah.
So it does. Exercise and keeping fit is not about the body size. It's about you have screened yourself. Everything is okay. And screening, I want to speak to men. Most of us go to hospital when things are not.
Things are very bad.
Everything is gone, really gone. In this age, most young men right now are struggling with ED, erectile dysfunction. It's not the topic of today, but I just want to mention something. Some of us have kidney issues we don't know about. We have kidney stones, very big ones.
Some of us even have heart issues we don't know about. And then we go to the over-the-counter and take the blue pill, and then suddenly you're collapsed and nobody can actually help you.
So in most cases, you will look for a quick fix because you say, I'm healthy, nothing can happen to me. Not knowing that probably when you have ED, it could be a heart problem, it could be a kidney problem, it could be a circulation problem.
You could be having diabetes.
Yes, undiagnosed. So have you checked that all these things are not culprits? If they are not, psychologically, do you have performance anxiety? As in, most of these things, you will only get to know about them when you look for this information in the right place. And the right place to look for information, I'm not just discussing people, is not AI or internet. Internet is a collection of people's thoughts, and people have put there their thoughts. If I write there, this treats this, internet has no way of, unless it is a peer-reviewed journal, internet has no way of correcting me. You will Google, and that's what will come to you, and you'll do that.
Yeah.
So let us have this culture of
wanting to know the right information.
Yeah, and checking before we act.
Exactly.
And it's not like, you see, the thing I'm talking to men is, you will have your car serviced every month, every week. If you hear a small noise, you go to the mechanic. But for you, you cough for 3 days, then instead of going to the hospital, you buy a cough syrup. If it doesn't work, you get yourself vodka. You see,
so men, let's service your body is the same way we service the cars.
Our cars, yeah.
All right, so I know you mentioned something about heartburns, and that is something that is very common, especially with heartburn and reflux. And somebody will tell you, I have ulcers, or rather the misnomer of ulcers. Of course, now ulcers are the effect of having continuous, acid reflux and the rest. See, most of us want to say, no, that's just my ulcers acting up. Not really. But you see, also, it may be something worse. That's why somebody was, actually, you were talking about it recently, about gastric cancer. The reason why it's so undiagnosed is because we are all just taking heartburn medication. We are all just wanting to take the triple therapy for H. pylori, or when it is this way, it's usually H. pylori. If you go and test the whole population right now, maybe 3/4 of us have H. pylori. It doesn't mean we all need to be treated for H. pylori, no.
Yeah, speaking of H. pylori, actually the test that is available in the market, I don't know if things have changed, it looks for antibodies. And if you have ever had H. pylori in your system,
it will
always test positive, whether it's active infection or it was
not.
something from before.
Yeah.
So if you did treat H. pylori, you finished, then you go back and test whether it's active or not. It will be positive. So testing for H. pylori, rushing to test for that may not really help.
Yeah, because I know the indications for eradication. Not everybody needs to test negative.
Yes.
Like, you can get treated, you get tested after 2 months, it's still positive. It doesn't mean we need to eradicate it. No. So, most people will go and say, and actually, people who, like, what time you sleep and what time you eat actually matters. For those people with reflux, imagine the acid is burning your food pipe or the esophagus constantly. Of course, the esophagus will change.
Yeah.
And those are things with precancerous and cancerous lesions. So try and, like, some lifestyle changes. Go eat dinner like 3 hours before you sleep. Do your veggies, and you need to look at, you need to listen to your body. When your body says, when you eat that, you'll be in pain, then don't eat that.
Sure.
There are a lot of alternatives. We told, when I eat beans, this happens. Then whatever you're getting from beans, you can get from something else.
Sure.
Don't eat a lot of red meat. There are several sources of protein, iron, and everything else. Like, there are so many alternatives. And if you think a nutritionist appointment is just for somebody who is middle class or high class, you're very wrong. Everybody requires a nutritionist appointment or a nutritionist consultation.
Sure.
Yeah.
And
so, Ken, do you have something to finish with as we ask questions?
What I want to say is, in the healthcare sector, there are so many players. People like to call them healthcare practitioners. So we are so many of us that are pharmacists, medical officers, specialists, and everything. So I would want for people to understand that everyone has their own role, and there's no reason for you to expect someone who can't maybe perform a surgery to help you with surgery issues. There is specialization. So if you have a symptom that you can't understand very well, and you're not so sure if you go to a community pharmacy, you'll get help, just go to a doctor, consult. You'll get a prescription, they'll explain everything. You go to the pharmacy, they'll dispense the medication, they'll explain everything. The thing with us Kenyans, we like to do shortcuts. You don't want to waste any time. I want to go there, buy what I want, and run away. I buy what I want, probably I bought the wrong thing, I ran away, I go back to the house, I continue suffering. You would have spent some 2 hours, 1 or 2 hours, talk to a doctor, get to the root of this, get the right medication, get healed, focus on worthwhile activities. So for me, let us just utilize every part of the healthcare ecosystem. People doing records will do their records. People doing surgery will do a surgery if you need one. People prescribing for you and diagnosing diseases will diagnose correctly, and they'll send you where to get the meds. People dispensing will dispense based on the instructions, and they'll actually advise you on whether there is an MTM issue, drug interaction review, or there's an interaction, be it food drug or drug, or whatever thing you're taking. So if we utilize these people the way they were trained, we benefit more, other than overburdening a given section and overlooking others. Then we start saying the healthcare system does not work. The healthcare system works if you allow every specialist to do their bit. You just get into the queue, follow, go to the doctor, they send you to the pharmacy, go to the pharmacy, they need a review, call back, cyclical. You will get everything working for you correctly.
Right. Thank you so much. So I think we'll have a few questions. You can ask them on all platforms.
One question. What are some key screenings adults should not ignore?
All right. So key screenings you should not ignore. I know we talked about what's a good wellness package. For your heart health, look at your cholesterol. For your kidneys, we'll do your kidney test. For your liver, we'll look for indications of liver injury. Of course, your blood pressure, we'll also check your sugars. And of course, sometimes we want to test your urine and your stool, depending on what we are looking for. But your blood pressures, your sugars need to be at the forefront of your screening.
Yeah, I can add in something. So for the specific tests, it will depend whether you are a man or woman.
Yeah.
One. Two, it will depend on actually what you do for a living occupation.
And also age.
And age. Like if you work in an environment where there is a lot of dust, then you need to do something about your lungs and stuff like that. So it's not a blanket for everyone, but of course there are so many, the common ones that Dr. has already spoken about, those ones will apply to everyone. But there'll be a group of people who will
For
need
occupational
specialized,
safety and health,
and the environment in which they work and live.
So an interesting one, someone called Lawrence says, I beg to differ on H. pylori comment, and then continues to say, the test is an antigen test, and few weeks after completion of therapy, it's just negative.
All right. So thank you for your disagreement, and I acknowledge it. But also, there are several tests for H. pylori. We have the urea breath test, we have the H. pylori antibody, and we have the H. pylori stool for antigen. A few weeks after 2 weeks of medication, let's give an example. We take 2 weeks of the kit.
Yes.
And then, like, let's say 2 weeks later, and then you test. Doesn't mean necessarily H. pylori is going to be negative. And H. pylori and brucellosis are one of the things where we overtreat when we literally know I don't know how to say it well, but it's one of the misdiagnosed and mistreated issues. Sometimes you just have dyspepsia or gastritis. It doesn't necessarily mean you have H. pylori. And you can go ahead and give the patient all these antibiotics and the triple therapy or quadruple therapy, but there are only times where there's indication for eradication. You can be tested today, get the medication, go a few months later. H. pylori is orophycal, what you eat. So honestly, I also tend to differ a little bit. It's an antigen test. Yes, there's antigen, there's antibody, there's the breath test.
Yes.
But not every person is a candidate for H. pylori eradication.
Yeah, the thing I remember when I talked about the antibody test, there was a caveat to that. There could be other tests, but my focus was on the antibody test and how it works. And the thing about clearing bacteria within 2 weeks and the course is 2 weeks is actually a bit inaccurate, considering if I take, most of the times, if you take a 3-day course of an antibiotic, on the 4th day, you will still have an active infection. But it doesn't mean the infection is there. Most of the times, how drugs work is like this. They'll actually just
they are bacteriostatic,
attack the pathogen, but now your immune system is the one that is going to finish the job. So as to whether we can differ, science is a very big area.
Exactly.
Yeah. So we could be wrong, we could be right, but as far as the general information available is, most of clients with H. pylori are overtreated, like Dr. has said, because it's like throwing stones in the dark. You hope to hit something, and in so doing, you end up breaking so much glass. Yeah. So it's something that we could discuss in details, because we see where we are. There are things we cannot discuss beyond the scope of this live broadcast, because it's very technical for everyone else.
Yeah, because I remember there was a study that was done about, do we really need to eradicate H. pylori? Who do we really need to eradicate H. pylori from? And remember, you have to balance between the
Normal
flora, because clarithromycin, amoxicillin, the triple quadruple therapy, they also kill the normal flora. So if we kill your normal flora, how are we going to help you with diarrhea?
And that's why they usually prescribe with probiotics, prebiotics in that
situation.
Yeah.
All right.
Another question. What practical advice would you give someone taking multiple medications?
Okay, so practical advice for somebody taking multiple medications. Let's say you have diabetes, you have hypertension, you have, let's say you're also having a heart issue, or maybe also having a prostate issue. So practical advice, let us go with a practical situation. Patient 1 has hypertension, diabetes, and also, let's say, a prostate issue for a man. So usually some of the diabetes medication will be 1x2, others will be 1x1. So put your medication depending on time you need to take it. They're usually pill bottles that have Monday to Sunday, morning, evening. So if you're going to take your blood pressure medication, you're going to take your diabetes medication and your prostate medication in the morning, say this is morning, and then this is evening, this is before meals. Like, try to put your medication intake into your daily routine. When I wake up, I take this. Before I sleep, I take this. Then with that, you will not forget. And if you have a smartphone, you can put reminders.
I want to echo what Dr. is saying. There's something called Pillmet. Pillmet is it's like a plastic thing with spaces for you to put the drug that you'll take. So usually what you do,
it's actually portable. You can just put it in your purse.
It has Monday to Sunday. So on Monday, it has evening, morning, mid-morning, afternoon, evening. You see, it's so you will take your pills and put them. If you have a morning one, you put in the morning.
Or a caretaker can do that.
You can do that. That is one. Two, you could go back to your specialist or the doctor you're seeing and ask them to look for any fixed dose combinations. Like if you're taking 8 medications separately, there could be a brand in the market that has three of them in one tablet. So you see, you have reduced from 8 to 5. You get? Yeah. So there are so many ways about it. You only need to go out there and talk to
your doctor.
There's
so many combinations.
Yeah. Closing question. What is one health action every person watching today can take this week to improve their long-term health?
Oh, just one. I'd say diet. Ken will say physical activity. Can I guess for you?
No. Actually, what I was going to say is, for me, it's reflection. There was a point in time you felt healthier, happier, lighter, and all those things, right? What is it you are doing at that point? Can we go back to that point? That is step one. If you can do that, then you will know everything that is not working.
Yeah, the last time you were happy was when you were 8 years old. What was happening when you were 8 years old?
Just you have to go back to that environment.
I know. Also, if life is just too overwhelming for you, life shouldn't be that overwhelming. We have clinical psychologists. Come and talk to them. I mean, don't make your friend your therapist. They're also having their issues.
And they may use that against you when you guys fall out. But for psychologists,
they're professional. They'll tell you from an objective point of view. All right, so your closing remarks.
Closing remarks is HealthX is there for you. They offer so many services. I'm hoping that they'll share a link for you to download the app and enjoy whatever is there. We have, you can shop online, both OTC and prescription-only medications. And now for prescription medications, you just pick the medication. It will ask you to keep a prescription. We will follow up, link you to a doctor, talk to them. Probably the medication you've picked may not be very appropriate for your condition. We will make that correction to keep you safe. So I am asking all of you out there watching to take time, go to Google Apps, search for HealthX app, download it, and enjoy what comes with it, the convenience, the timeliness, and the care that you need.
All right. So for me, my parting shot is, I know if we are not unwell, we have parents who are unwell, and we are their primary caretakers. Let us try and also order their medications from us, and we deliver them to your doorstep. And of course, I'm being reminded that chronic medications are delivered for free. So let me just put that out there. People on monthly medications, they get free deliveries every month.
And then there is a follow-up for CDM.
There's a follow-up also. The doctor will call you and ask you what you're going through. Sometimes you probably have something else that is not even related to the hypertension.
Meds, yeah.
Maybe you even have a cold. Will show up for you. And also, just one thing for me, I know I've said a lot, but antibiotics, let's not overuse them, because when you do overuse, you're going to be transferring the superbug to the rest of us who have tried to be very good. Right? Thank you so much, and we hope to see you here next week, same time, same place.
Thank you.
Thank you.
Thank you for your time and sharing knowledge.
You're welcome, Lawrence. And we hope to see you next week.
Sure.